My name is Dave Wilkin. I'm Chief Operating Officer of OCCU and also leading out our cluster projects in Peterborough and up north with the McIntyre Mining Group. Today we're going to have speakers from Local 1987 at the Ventra Plastics plant, as well as several people from OCCU to bring you up to date with our work on this particular project. And then also from the Workplace Safety and Insurance Board and the Ministry of Labor Training and Skills Development. Okay, so with that, I will hand it over to Rose Wickman, who's the former, now retired president of Unifor Local 1987, which represents the workers at the plant.
Hi, everybody. I'm Rose Wickman. I'm past president of Unifor 1987 in Peterborough, the Ventra Plastics Group. I'd just like to reach out and thank OCCU and everybody who worked so hard, Bob and Dale DiMatteo, who put this study together for us, and all the workers at OCCU who have serviced us so well. And I just want to give you a little bit of past what we did. As everybody knows, we started out a long road in 1998 when we started noticing different illnesses, occupational diseases, cancers, heavy amounts and concerns with all the workers. And we turned to the National Union at that time, CAW, and asked them to help us. They referred us to OCCU. In 2004, we did an OCCU clinic. We had, I believe at that time, we had around 125 people come out to our clinic. We did the clinic, and then Dr. Cairns, he met, and Dr. Judd Nigwig, they met with most of our workers. Then it kind of took a lull, and we picked it back up, and I know it's been slow, but OCCU is working really hard to help us through this. And since that point to this day, we have done seniority lists, we have looked at compensation, we have looked at everything, and the amount of concerns we have in the plant from the Pebra days is very concerning to the workers. We did a study, and now we're trying to move forward, and we're hoping to get all employees who would come out and meet with the clinic. And if you've got issues, or you've got a deceased member, or if you've got breathing problems, please come see OCCU and get things started. We don't know if you'll get a claim, but we're going to work hard to prove it's work related to the best we can. And I'd like to turn this back over to Dave.
Now we'll hear a few words from Chris McFadden, who's the newly elected president of Local 1987.
Hey, okay. Dave, it's Jackie.
Yes.
I'll speak in Chris's absence. So okay. I think what we want to do is, I mean, I've been very much involved since 2004, the first intake clinic. Dug through stuff from years and years ago to get to where we are today. I think what we want to know now moving forward is, where are the commitments for OCCU, for WSIB, and I guess the recommendations that we put forward in August.
Thanks, Jackie. Maybe we can, well, we'll be able to have some questions hopefully later. So if you have additional questions for the WSIB that aren't covered in their presentation or for the ministry, I think you can ask them then. Also, anyone who has questions, who is watching live either on WebEx or on Facebook, you can put questions into the chat boxes, and we will come back to those and answer them the best we can.
Wonderful.
First of all, I'm going to answer a couple of questions that we've had so far come up dealing with legal issues surrounding the situation currently. So prior to working for OCCU, I was a lawyer, and before that a non-lawyer workers' compensation representative dating back to 1990. So I've been around the block a few times, and also represented the Ontario Network of Injured Worker Groups on the WSIB's Occupational Disease Advisory Panel back in the early 2000s, and then the Ontario Federation of Labor during the funding review that happened about a decade ago now. So there are a couple of questions that have been raised that I wanted to give general answers to in case there are others with the same questions. First is, because the Ventra plant is still open, there may be concerns that applying for WSIB for occupational diseases could drive the company out of business because it will cost too much money. And I'll address that one first. And then there are some paperwork issues related to releases, settlements, and time limits on WSIB claims. So first of all, on the funding issue, it is true that claims affect WSIB premiums. And we're just now in a transition stage in terms of how premiums are calculated at the WSIB, but both in the old experience rating system that would have covered Ventra and in the new risk banding premium system, claims costs affect how much an employer pays, what rate they pay per $100 of payroll. But it was the case both under the old system and will be under the new system that long latency occupational disease claims are excluded from the calculations that are relevant to those issues. In the past, so in the past, that was rebates or surcharges on premiums paid, and going into the future, it's a prospective risk banding exercise. Disease claims like that are funded on a sectoral basis. In the case of Ventra, that means that in theory, they go into a pool of about 2,700 employers in the non-metallic and mineral manufacturing class, which has a total of $6.7 billion in assessable payroll back in 2018, and no doubt $7 billion by this point. So if you had, for an example, a company that had 200 workers and their average wage was $50,000, that would be $10 million in assessable payroll, or about 1/700th of the payroll burden of that class, and that would be the proportion of the premium money going into occupational disease claims that would come back to that employer in the long term. So the short answers are: first, Ventra pays a share proportionate to its payroll in that class, adjusted for its accident claims, so back injuries and that sort of thing. But it basically pays the same as it would if those occupational disease claims were happening at another employer entirely. The direct financial impact is greatly lessened by the way that the funding scheme is set up. Also, very importantly, to the extent that the WSIB's actuaries are getting it right, Ventra has actually already paid its share for any occupational disease claims that are made today related to diseases that have already been diagnosed and exposures that have already happened in the past. Because unlike other injuries where they are taking an accounting of how many happened this year, and looking at significant markers related to the amount of time off work on benefits, whether or not there's a permanent impairment, et cetera, and then setting a cost and adding that into the board's liabilities retrospectively. With occupational diseases, they are also projecting this out into the future to say, we don't think all of the occupational disease claims arising from mining operations, for example, up until now, have actually come in. There's new scientific research going on. We may get a new claim for someone who died 10 years ago that now has to be allowed due to new scientific research. And they do their best to try to set aside money for those circumstances in advance. So in this case, not only does Ventra not directly bear the cost of all the claims, but only a portion as a member of the sector? Also, they should have already paid that if everybody's got their numbers right. Next was the question of releases. So on the left on this slide, you can just see the first page of a release that was signed by someone who was left Ventra back in 2014. And it's sort of a standard agreement that one signs when reaching an agreement to leave employment, to settle any possible grievances or claims with employment standards and that sort of thing. And the language is always very, very broad. So with this one, they're releasing Ventra from any and all amounts owing, actions, causes of action, claims, complaints, obligations, damages, liability, claims, statutory rights, et cetera, et cetera, et cetera. So the question naturally arises for people, does that mean I cannot claim benefits under the Workplace Safety and Insurance Act for an occupational disease because I signed this release with Ventra? And the answer is no. And there are some lists in here of particular things as well. Workers' comp is not on those lists, and with good reason, because it's always been the case that such an agreement would not have any legal force and effect. So Section 16 of the Act, an agreement between a worker and his or her employer to waive or to forego any benefit to which the worker or his or her survivors are or may become entitled under the insurance plan is void. And the use of the term void means it's not just an agreement that you can get out of. It's an agreement that for all legal purposes never existed. It has zero impact. So even if it said in there, you can't claim WSIB benefits, that would not exist legally, could not be enforced, and would be likely severed from the contract so that you would still be able to keep the money as well. Settlements. You often hear people talk about settlements of WSIB cases. So then there's a question of, well, okay, if we all are working on this together and going as a group, does that make it more likely the WSIB will settle the claims and we'll be able to get out of this relatively quickly? Settlements in WSIB are not a thing. You hear people talk about them sometimes, but it just really does not exist. The WSIB and then the appeals tribunal adjudicates claims. It doesn't settle with anybody. It makes a decision and is, when doing so, does it within its policies and within the Workplace Safety and Insurance Act as it interprets it, and then as the appeals tribunal interprets it, sometimes differently. So there are some things that kind of look like a settlement, but usually those have to do with things like returning to work and an agreement between a worker and an employer that a job is suitable, or that the worker would go back to a particular job, and but it's never really a settlement. It always has to be, to the extent that it has any legal force coming from the WSIB, it's always a decision that's made based on a judgment that it is in accordance with the Act. So the only way to get out of the process is not through a settlement. Walk away. You can get your claim adjudicated in your favor, get it reconsidered. You can appeal it, and that's the way it goes. So there's no sort of a shortcut to settlement from this kind of a process. And then finally, time limits. So there are two 6-month time limits and some other ancillary things in the Act, but two important ones for this situation. First is a 6-month limit to file a claim after you become aware of an injury or disease. That is routinely waived for long latency occupational diseases. The second is a 6-month time limit to file an appeal once you have a decision. Those can be extended for several reasons. I won't belabor them now, because if you're in this situation, you really should get proper legal advice directed to your individual circumstance, and we can help you out with that. And if you contact the local office, if you have a question about that, they can get you in touch with us, and we can refer you to a legal representative who can answer those questions. But one that's very important in this circumstance is new evidence. If new evidence arises that was not available at the time the original decision was made, the WSIB can then extend the time limit and reverse its decision. And here we have new evidence, not only in terms of ongoing research regarding exposures in the plastics industry, but also the historical exposure report that we'll be reporting on in a few moments. So the lessons that arise out of all of that are just, you should file a claim. Really should file it as early as you feel comfortable doing it, and there's no reason to feel uncomfortable. I don't think in this situation. The presentation of it is not that important in a case like this, where there will have to be an investigation of your exposures over your entire working life, and the diagnosis of the disease. You can register with OCAL. There'll be more information on how to do that later. We'll give you a phone number, but also you can, again, simply contact the local and give them your information to pass along to us, and then to obtain legal advice. And again, we can help to set you up with that. There are a number of considerations in terms of who can get representation where, and we're also able to help you as individuals and the local to navigate that situation. Okay, so now I'm going to give a very quick introduction just to OCCU in general before we pass it along to the DiMatteos to present the exposure report about the plant itself. So we are a labor organization. We were founded by the steelworkers local in Hamilton at the Stelco plant, along with some academics at McMaster University. We've expanded since 1981. When that first happened, we became a larger entity with funding and offices in 1989. We now have 7 clinics across the province, in addition to our satellite office in Peterborough. Our board of directors that sets the policies we operate under continues to be mostly representatives of labor organizations from across different sectors of the economy, and then some community representatives, the injured worker groups, and legal clinics. We're a designated health clinic under the Occupational Health and Safety Act, which means that the Ministry of Labor can provide us with funds that it gets from the WSIB from their premiums. But again, we definitely are and consider ourselves to be at arm's length from both the ministry, and double arm's length from the WSIB, and to be operating as a professional source of medical and scientific advice and opinion for workers. Okay, here's the map of our clinic. The last time that we were when we were previously working on the Ventra's files, the green and gray areas there were together, all serviced from Toronto by a staff of, I think it would have been 7, plus some contract physicians back then to service all of Toronto, all of the greater Toronto area, all the way up through Kingston and Ottawa and so on. And, we feel, and I know that some of you do, like we didn't really finish the job in some ways with respect to Ventra. And that's one of the reasons that we've been taking our recent actions, and that we've been doing them in the way we have. We have a number of different services, all of which are sort of piled together in this instance. So diagnoses for possible work-related conditions, services to groups of workers for identifying hazards in their workplace and ways to fix them, inquiries, outreach, and education, which we're going to try to share information with you over the course of our further work, and research and tool development. We have physicians on contract, including specialists in several specialties, including occupational medicine, occupational health nurses, occupational hygienists, ergonomists, administrative people, and then our more central admin stuff. So occupational disease intake clinics, which is how our work with Ventra started out, are something that happens, particularly when plants are shutting down or when people have noticed an unusually high rate of disease and want to have it investigated. Usually, these take place more as social events that happen over several days, obviously after a lead-up planning, and then with a lot of work afterwards. But we bring people together, do an orientation session similar to the one that we're doing now, and education over the known hazards from the workplace or the industry. Register people with OCCU, which includes getting consent for the collection, use, and disclosure of personal health information. We are a health clinic. All the rules that apply to any other doctor's office or hospital with respect to the protection of information apply to us. We only release it, even your name or the fact that you are seeking our services, only with your individual consent. We do then individual health histories, individual work histories at those clinics, gather together historical information that people bring to us. And then those go into body mapping with respect to the health conditions, exposure mapping with respect to the workplace. And we're currently working on this process again remotely with respect to your plant, doing research on the possible work-relatedness, looking for commonalities. In your case, we have also information going back to 2004, questionnaires that were done at our first intake clinic. We organize and process the information, do reports, individual reports where they're necessary because people are pursuing an appeal on a WSIB claim. We file appeals or file claims for people where they'd like that to happen, through a doctor working with our clinic. And we share the general information, again, not ever individual information unless we are directed to by you, but the general information with partners in the health and safety system, academic researchers, et cetera, and also give feedback in terms of public information meetings for foreseeable future webinars. So if we were all getting together in person, we would be taking our health questionnaires and putting them together into a map like this, where we're indicating what are the different health conditions. Each of these different colored stickers represents a different medical condition. And then here's a map of the GE plant in Peterborough, showing with different colors different hazardous exposures in which buildings of the plant they were occupied in, or they were used in. And in the case of GE, that also resulted in a lengthy historical exposure report that documents the work processes and exposures throughout the entire workplace. It was a project that was begun by an OCCU hygienist with our Toronto clinic, again, one of two, covering that entire area all the way out to Ottawa. But she mapped out the processes in the worst areas of the plant, the highest asbestos exposures. And then that work was continued, and the methodology developed by Dale and Bob DiMatteo, who will present in a moment, who completed that work for all of the GE Peterborough plant. So, and that's a participatory project with a committee of workers who've worked there, matching up what they have to say with the documentary evidence about exposures from the Ministry of Labor inspections, the Joint Health and Safety Committee minutes, walkthroughs by OCCU, the material safety data sheets, etc. So when our office in Peterborough opened a couple of years ago, we also decided to, well, and this is just sort of an example of public information session, and we also then will, it's already happened with respect to some of the GE issues. In Peterborough, a talk at Grand Rounds at the hospital by Dr. Karen, who typically works at our Peterborough satellite office. This picture is of a meeting at the hospital in Elliott Lake regarding some miners. So we're going to do our best to make sure that the information about your plant and the associated health conditions both comes back to you and is communicated to the medical community in Peterborough. So as I said, we did an intake clinic regarding Ventra in 2004, and we've seen a number of other people over the years. We had approximately 140 files that have been opened regarding workers from Ventra over the years with respect to occupational diseases. And then we took as our first step in putting a concerted effort into re-engaging, into putting together a report similar to the one that I just showed you from GE regarding the exposures in the plant. It covers the Pebra period from 1986 to 1996. Most of that work was completed in the first half of 2019, then further refined. It's available on our website as well. The address is on the next slide. With that report, we've gone back through all of our files, including the ones that had previously been closed. One of the issues that has also arose from your workplace that has actually led to us changing the way that we do business in general was communications from people when we closed their file that they did feel kind of just cutting them loose and abandoning them. If you would read the fine print in the letter people got when their files were closed, it would say, please come back to us if you need any further assistance, etc. And we would have been happy to do further work. For example, if somebody needed a more detailed report because they were pursuing a WSIB appeal. But it's, obviously was not communicated effectively. It also left us in the situation where we were not aware, and I think this affects our work. We were not aware of what the results were when we filed a claim for someone or wrote a hygiene report or a medical assessment. We would, for example, send in a Form 8 to the WSIB to file a claim along with a brief report outlining the exposures and the doctor's opinion that it was related to work, and then close our file immediately. And unless someone would come back, either the worker or their legal representative to tell us what happened, we had no idea. So we have now instituted the practice across OCCU of not closing files, but continuing to follow up to find out what has happened with our work. And then if there's nothing for us to do now, that we still would sort of file it for a future follow-up date in several years, but never to leave anyone feeling abandoned in that way. So we've gone back following that review of our files to contact people with closed files to follow up what has happened, how has their health changed over the last 10 to 15 years, depending how long we've been out of touch with them, and to begin the intake process again for any of those who are interested in registering with us and having us look at their situation again. And also for people who really just want to document the state of their health, or even without a health condition, to document what their exposures at work have been. And again, that will be kept by us forever, and always be there available if any need for it arises in the future. It's also very helpful for us in doing our work for people who do have health conditions and require hygiene and medical assessments. So here is the front page of the report that was prepared regarding the Pebra period at your plant. The web link is there on the bottom. You can reach it via our website just by navigating the menus as well. And now I will hand it over to Dale and Bob DiMatteo to review the content of that report. Then Janice Martel, who I left an L off her name, Martel with 2 L's, will give an update just about where we're at in the process of contacting people and information for people who've never been registered with OCAL on how they can get in touch with us and register. Andrew Zarnke will review some of the general health issues that we know should be of concern in your plant and others like it. We have Dr. Karen on the line. If there are any questions that would be appropriately directed to him at the end about general issues, but at this point, again, we are still in an sort of investigative mode about what's happening there. So he'll be presenting at a future webinar, we hope, once we have more information in. And also we will be inviting some other researchers to present to you at future webinars. So with that, I will hand it over to Dale and Bob DiMatteo, who can introduce themselves with respect to their histories and credentials and show you around the report.
Thanks, Dave. We're pleased to have this opportunity to share the results of this report with the Pebra Ventra worker community in particular. I've been a researcher for about 30 years. I spent 20 years at the hospital for sick children. I have a master's of health science, and I've done a lot of research, both at the local level and national, written a number of reports for it. When I retired a bit early, I did about 10 years of research as a consultant at the University of Toronto with various health science projects, and I've written a number of articles in peer-reviewed journals. Bob?
Well, before retirement, I worked at OPSU for close to 30 years as the health and safety director, for OPSU. Prior to that, I was a university teacher as well as a college teacher in Ontario, and conducted quite a bit of research under the arch of OPSU over the years, and more recently engaged in the breast cancer study with Jim Brophy and Margaret Keith, and work with them to provide some kind of an exposure matrix for that study, and produced a lit review alongside that on the plastics industry and breast cancer. And of course, we have come out of retirement, I guess you want to call it that, and are doing these kinds of things, which are really important. Anyway, I'll turn it over to Dale, who will kick off the report.
Okay, thanks, Bob. This retrospective study of the Pebra plastics plant in Peterborough was funded by the Occupational Health Clinics for Ontario Workers to address long-standing occupational disease concerns of employers. In 1986, Pebra Inc., German auto parts manufacturer, set up operations in Peterborough in a 200,000 square foot ironclad building with 75 employees. Initially, the company finished small parts manufactured in Germany, but it quickly expanded to produce multiple trim parts from scratch, soon employing more than 500 employees until its bankruptcy in 1996. We will discuss the different aspects of the Pebra study, including the research methods, sources of information, and the significant findings. At the end of the presentation, we make recommendations for positive change. The work of the advisory committee involved extensive mapping of each work process during the Pebra era. We gathered information from multiple sources to recreate historical chemical exposures. This involved documenting the chemicals used, tasks and flow of production, work practices, use or lack of exposure controls, and information contained in inspector reports relevant to the work process. From this data, we developed detailed exposure risk profiles that can be helpful in making a link to various occupational illnesses reported by workers. A permanent focus group was formed consisting of 7 long-term employees or retirees who met for 4 to 5 hours twice per week for a period of 5 months. Other workers with special knowledge of a work process being discussed were invited to share their knowledge and experience. In addition, advisory committee members accessed plant and government documentation on chemicals and risk events, including MOL and consultant reports, Joint Health and Safety Committee minutes, union safety logs, and MSDSs of chemicals used between 1986 and 2000. Local news clippings and Ministry of Environment documents were also obtained. Literature reviews on the plastics industry were conducted, including chemical exposure and health studies. In documenting chemical exposures, we applied a risk-based approach using basic hygiene concepts related to chemical exposures in the hierarchy of controls. Concepts that have a direct bearing on exposure risks include the physical state of chemicals used, volumes handled, proximity, duration, and intensity of use, work practices, as well as worker access to information and exposure controls. Extensive group interviews and rich documentation provides an historical window into Pebra's health and safety culture. This photo is an example of advisory committee members leading a risk mapping session. Risk mapping was used extensively to recreate a detailed visual representation of the production processes, thus providing a continual reference point for discussions. There were many exposure risks that workers shared in common, given the open structure of the plant, in addition to those related to their particular job tasks. These include 1. Close proximity of workers to production processes in a large open concept building that included a metal-covered paint line in poor repair and an open sluiceway carrying toxic waste to the sludge room. Both were major sources of air contamination. 2. A ventilation system that was inadequate, outdated, and in poor repair. 3. Massive amounts of solvents continually in use, including PERC, TCE, MEK, and Pebra 5, used in all work areas as both a cleaner and a glue. In addition to large-scale gluing and solvent application, workers had a personal supply to clean off their tools and hands. 4. Frequent cleaning and purging of all molding units with solvents and purging agents, in addition to frequent spraying of mold release. 5. Frequent large volume spills of paints, solvents, and glues, as well as line and valve ruptures. 6. Large amounts of dust produced daily from sanding, sawing, grinding, and buffing in major departments, made worse by the use of large, freestanding, oscillating fans and compressed air guns to clean off surfaces and clothing. 7. Fugitive emissions from resin and solvent fumes caused by ventilation failures and frequent spills or fires. And 8. The practice of eating, drinking, and smoking at workstations. Pebra used and generated massive amounts of toxic chemicals. For example, in reviewing more than 300 MSDSs, most products contain between 3 and 5, and sometimes more, hazardous ingredients, in addition to combustion and decomposition byproducts that were created. An environmental assessment of the plant ordered by the Ministry of the Environment in 1995-96 identified that Pebra generated 1.5 million pounds of VOCs and used over 200,000 U.S. gallons of paint annually, in addition to enormous quantities of thinners and solvents. Engineering stack change made to improve outside air quality in order to protect the community resulted in worse conditions inside the plant for the workers. Many of the chemicals used at Pebra are rated as a carcinogen, a mammary carcinogen, an endocrine disruptor, a neurotoxin, a fetal or reproductive toxin, an irritant, or a sanitizer. Such chemicals are capable of causing physiological damage to body organs, especially to the lungs, the kidneys, the bladder, the liver, and brain. I will now hand this presentation to Bob.
Most exposures in this plant involve exposures to a complex mix of chemicals. The origins of these products are the result of decomposition and combustion during the thermal processing. Workers were routinely exposed to things like benzene, silica, resin dust containing isocyanate residues, asbestos, vinyl chloride, phthalates, acrylonitrile, styrene, butadiene, cadmium, lead, trichloroethylene, toluene, methylethyl ketone, xylene, epichlorohydrin, bisphenol A, welding fumes, metalworking fluids, and isocyanates, to mention but a few. These are all listed as hazardous ingredients on the material safety data sheet supplied by the manufacturers. This chart illustrates the complex chemistry of polymer products. This is a list of chemicals used in the production process of Pebra and the complex mix that results during production. Note the large number of decomposition byproducts in the right column produced from various monomers and polymers undergoing thermal processing. From the time chemicals enter the plant in receiving till they are shipped out as finished products, there are a number of major exposure risks for workers that include, in the receiving department, diesel fumes, for example, resin preparation, exposure to the dust from manual mixing, thermoplastic molding processes, whereby fumes and gases would be released during the molding process. Finishing and fabricating, exposure to dust from sanding and trimming. Assembly, exposure to fumes and dust from sanding, buffing, gluing, in addition to fugitive emissions from other sections of the plant. Paint line, purging and cleaning, heavy fumes from smoldering purge resins that dropped on the floor. Regrinding. Other risk factors were continually identified. These include poor work practices, poor ventilation, heat stress, inadequate PPE, poor training and ventilation access to information, and a poor health and safety culture generally. The latter was exhibited by the company's extremely low scoring on a WCB audit, achieving a mere 100 points out of a total of 1,500. Importantly, workers were denied access to MSDSs and not provided with training. It took a mass work refusal in 1992, along with a threat by the Ministry of Labor to post an inspector full-time at the company's expense to eventually secure training and access to MSDSs. Thanks to Sonia Lal's previous work at this plant, we were able to assess the airflows in the plant to illustrate how the flaws in the ventilation system affected exposure risk. As well, there was major lack of local exhaust ventilation frequently cited by inspectors. All of these are indications of poor exposure control, along with a pattern of WSIB claim showing signs and symptoms as the leading diagnosis and chemicals as the leading exposure. Following the events lend support to the contention that workers were being overexposed chronically. Frequent individual and collective work refusals were a matter of course at the plant. In a number of instances, work refusals closed the plant down for a month. The MOL noted that it had 2 full-size filing cabinets just for Pebra work refusals. In addition to individual work refusal, it was common to have an entire shift on refusal. There were frequent mass hospitalizations. At times, workers were transported en masse to hospitals, 15 to 20 at a time. There were frequent reports of dizziness, shortness of breath, eye and upper respiratory tract inflammation and irritation. sensitizations, both acute and chronic. Dust levels were so bad in sand and trim that it was no surprise that obstructive lung was diagnosed by the plant physician. The doctor is quoted in the inspector's report as saying, a large number of workers in sand and trim have obstructive lung, and these were based on lung function tests that he had performed. Workers' loss of consciousness and having seizures. These signs and symptoms are also frequently cited as indications of overexposure and adverse health outcomes in the MSDSs themselves, which were occurring at below the OEL. The following chart is an example of how we documented and assessed exposure risk for each production process. Note that each process is broken into tasks, the products applied, their physical state, and the likelihood of exposure. Report's appendices provides two sets of charts providing more intricate detail and third-party verification. Here we compare two approaches to assessing risk for adverse health outcomes. The column on the right typifies the predominant approach taken by regulatory agencies in assessing worker concerns. These are usually based on comparing air concentration measures to the OELs or the TLDs. Usually based in contrast, the approach on the left relies on qualitative data based on workers' observations and experiences, supported by industry population exposure data, and includes assessment of both inhalation as well as dermal and ingestion routes of exposure. We also take into consideration exposure to endocrine disrupting chemicals that have effects at infinitesimal levels, not in parts per million, nor in parts per billion, but in parts per trillion. For example, most industrial hygiene measurements of chemical concentration could not be relied upon in terms of the materials we reviewed. Most often, these were instantaneous short-term samples with colorimetric readings. Long-term sampling was plagued by unrepresentative samples due to poor sampling strategies, sampling after the cleanup, outright sabotage of sampling. In fact, the Queen's University hygienist conducting a thorough hygiene assessment of plants cited purposeful low work volumes, production interrupted with unscheduled coffee breaks, sampling equipment malfunctions, etc. There is a rich literature raising questions about the accuracy and reliability of measuring air concentration and whether OELs are really health-based limits. On that note, this shows the disproportionate body burden sustained by plastics workers exposed to 4 major plastic resins and additives compared to non-work exposures, i.e., general population or control groups, as measured in blood and urine. In other words, what is actually in the body. In addition, these studies make a number of important observations with regard to bioaccumulation in plastics and the relationship between body burden and air concentrations. For example, acrylonitrile trial in urine was 11 times higher in workers and persisted on days off and despite air concentrations that were below the OEL. Styrene in blood was 5 times higher in workers. Job task was the best predictor of body burden and is directly proportional to the extent of manual handling. Phthalates in urine. There was a significant uptake of phthalates while air concentrations were not even detectable. Phthalate metabolites are higher in workers than in general population, while phthalates in air are again below the OEL. Having said all this, so what do we know about occupational diseases at Pebra, Ventra, both reported and potential occupational diseases identified? This slide presents 3 sets of data identifying occupational diseases at Pebra, Ventra, including WSIB data from 1985 to the present, OCAL clinic master list over the last 15 years, and 3, an exploratory disease count conducted by the advisory committee from the plant's seniority list. We note the following observations from the chart. Of the 301 occupational disease claims, 19 for cancer included 6 for leukemia, 5 for lung cancer, 8 for cancer groupings of less than 5, and fewer than 5 cancer claims have been allowed. As well, a total of 186 claims of the 300 claims have been allowed, 67 denied, less than 5 pending, and 42 abandoned. The leading exposures, and this is kind of important, leading exposures are overwhelmingly chemical, and the leading diagnosis was the board's classical signs and symptoms at 135, followed by respiratory, 38, skin at 34, and neurological at 32. Kind of consistent with the type of exposures that went on in that plant. With respect to the OCCUPATIONal registry, it shows 133 occupational diseases and 33 cancers, led by lung, and 26 others in groupings of less than 5, which can't be identified. Other non-cancers include asthma, COPD, neurological, and reproductive abnormalities. The Advisory Committee report. The Unifor Advisory Committee survey found 403 occupational illnesses, including 116 cancers, led by lung at 32, followed by breast cancer at 22, 10 cancer with no site indicated, 8 kidney, 7 gastrointestinal, with 37 in groupings of 4, which included thyroid, brain, skin, bone lymphoma, non-Hodgkin's lymphoma, salivary gland, bladder, cervical, prostate, and pancreatic cancer. It's our view that the complex of chemical exposures in the plant strongly indicates that these diseases may be significantly related to such exposures. We find it hard to conclude otherwise, and the investigative work of the advisory committee indicates that the extent of occupational disease is far greater. This conclusion is increasingly supported in the epidemiological and biological literature. Finally, what we'd like to do is make a number of recommendations that the committee has developed. Firstly, that the WSIB reconsider and review all denied and pending occupational disease claims in the light of the new exposure evidence in this report and the findings of Dr. Paul Demir's recent review of the state of science on occupational cancers, particularly his exploration of multiple exposures and exposures to complex mixes. Secondly, that the WSIB fund an independent investigation into the findings of excess cancers and diseases identified in the Unifor 1987 Advisory Committee's survey. Third, that both the Ministry of Labor and the WSIB initiate a fund an inquiry into the role played by endocrine disrupting chemicals in the development of occupationally related cancer and other hormonally related cancers and diseases. Fourth, that the Ministry of Labor and the WSIB institute an occupational exposure and disease surveillance system for the plastics industry. In this latter regard, we note the recent occupational disease surveillance study of the plastics and rubber industry by Nathan DeBono and colleagues at the Daliana School of Public Health as a good first start in this direction. Thank you very much for listening.
Okay, thanks very much, Dale and Bob. On behalf of OCCUPATIONal, thank you and the committee so much for your hard and excellent work on this report. I will pass it on to Janice Martel, who's going to update us all on the progress on our calls following up with the workers who registered with OCCU already.
So since August, back in March and April, OCCU did a multidisciplinary review of 107 closed Ventra files, and 95 of those were identified for follow-up calls. So currently identified with the OCCU, Ventra, and Pebra worker list, we have 140 workers, but 3 of those don't have an open OCCU file. They were names on a list that the union had provided to us. So we're doing our best to kind of track down current phone numbers and stuff. The union has been great to provide what they have for their membership, and a lot of those relationships are still there, so they can track down some of the numbers and such for us. Of the 140, there were 3 new registrations as a result of these follow-up calls that we initiated starting in August. So I have been the person starting those calls. So the McIntyre Powder Project team is basically, from what we've learned from our work with those files, because when you do clinics, you take in a large number of a massive information from a large number of people, and there's a lot of administrative follow-up to try and get medical records, WSIB claim files, those kinds of things, confirmations for estate executors, that kind of stuff. And so we've learned a lot from sort of that lessons, what works, what doesn't. So the Peterborough office is staffed by Dr. Kieran and Kasha. Kieran in the administrative role, but there's part-time hours there, and these files they received from the Toronto office to the Peterborough office. And so we went through all of them, like I said, back in March and April. We identified 95 for follow-up calls, and those were conducted between August and October. It turned out to be 98 altogether with the 3 new calls. The 3 new calls are basically from contacting people, and they have a child or a sister who worked in the plant, or they themselves. I was calling an estate file, and she, the wife, the survivor, worked in the plant as well. So we've registered them. I was able to, of the 98, reach 65, spoke to 52 of those, and 13 messages left. People have been pretty good to respond with messages. I haven't done a second go through of the people that I contacted and left messages for. I was unable to, but I will, sorry. I was unable to reach 32 of them. 22 had no valid number. The last number that we had or that the union had wasn't valid. I have since been provided with an updated list from the union, and I'm going to work on those calls too. 10 of them were deceased with no estate contact info, so I'm not sure who the executor of the estate is. So if the number was out of service, I would check Canada 411. I would also check obituaries, and found most of those 10 through that process. And based on that, we're seeing that there's some definite, based on what you can read in the obituary, that there's some definite health issues, young deaths, that sort of thing. I did not attempt to contact one worker who we were trying to track down a phone number, and the union had indicated that they weren't interested in for future contact. Of the 42 remaining, so the 140 on our worker list minus the 98, that's our next focus right now, is sort of going through those, figuring out which ones are already open and weren't reviewed in our process. Because of that, we're going to be looking at all of the open files as well to determine what other steps are needed. So when I do the initial follow-up calls with people, anyone who is interested, and there's, I would say, at least 2/3 to 3/4 of them have been interested in updating and refreshing their files and updating their information, book them in for a consent call with Kasha, so that she goes over, we've updated our consent forms that really break it down into different sections of what they're consenting to with the union, with providing information to any legal representative that they may have for a claim, that sort of thing. And then Kasha sends out, goes over the consent forms on the phone, sends them out to the workers or the estates, and also books them in for a health history interview that we're doing remotely with our occupational health nurse. And one of two, once that call is complete, the person would get, or estate would get booked in for a telephone call with one of our occupational hygienists. We have two of them working on the Ventra worker files, and going over their work history, updating anything, they may have left the plant and are working somewhere else. So they take a full work history as in the different plants, what kinds of things they were exposed to at Ventra and elsewhere. And then we, after that, we determine which files will be needing further workup, and what kind of workup we're trying to pursue, getting copies of WSIB claim files for denied claims of occupational disease so that we can review them in light of the DiMatteo Unifor report. We're certainly informing people about the report and about our webinars. There's many that don't have computer access or aren't computer literate or comfortable with it. So we're trying to provide them with as much information. I've sent out hard copies of the DiMatteo report to probably about a dozen or so workers who probably regret getting them, because when they realize that they're 255 pages, but they're actually, I'm kidding, I've had very good feedback. Actually, somebody who thought that they weren't interested in updating their file called back and after reading the report and said, yes, this is important and I need to. The engagement has been quite good. People are very grateful. Even the ones who decide not to reopen their file, it's 95% of the time, it's because they don't have any new health issues, and they don't, that's the main issue for them. And then we're opening it up to register any new Ventra or Pebra workers who were not previously registered with OCCU. There is OCCU's old 1-800 number has been assigned to my cell phone for the last 4.5 years. So that is how the McIntyre Powder Project miners have been getting a hold of me. So it allows a little bit of flexibility for some of the, I take evening calls. I've taken calls pretty much all the time from people because it's important. So workers can call that. I did not put that on the slide. I apologize. It's 1-800-661-7120. I will add that to the chat, or if somebody can add that to the chat, and people can call me. Please leave a message if you don't get a hold of me. I will call you back, and just with a name, phone number, and that you're a new registration from Ventra and Pebra, and then we'll go from there. Some of the stuff that the DiMatteos were presenting was really resonating with me, because in preparation for these calls, I'm going through the old files to see, what the health issues were back then, if there's any new health issues and that sort of thing. So the the when you're talking about dizziness, memory loss, confusion, I was seeing that coming up a lot. And Andrew will be talking about some of the health issues that we're seeing with active issues in the plant as well. Thanks.
Thank you for having me here. So I'm Andrew Zarnke. I'm kind of a partial project manager that's kind of come from the McIntyre Powder Project, and working really closely with Janice and the entire team, all the doctors and occupational hygienists, and just really trying to help coordinate all the different pieces of the project. And I've also got a background in biological research, and I'm currently pursuing my PhD in human kinetics at Laurentian University. So I'm going to just kind of, like Bob and Dale did a great job of highlighting this broad overview of all the health issues that they saw in their research. And I'm really just trying to just highlight some of the issues that have come to the forefront that OCCU is actively researching and investigating. Even though we're actively investigating the potential work-relatedness of all the health concerns that you bring forward. So this is table 1 directly out of Bob and Dale's report. So I kind of wanted to show you that and kind of zero in on some of the things that I'm going to talk about. And the first thing I want to talk about are the breast cancers and these reproductive issues. And as you all know, obviously, there was a large proportion of female workers at Pebra and Ventra throughout the years. And I'm just kind of highlighting some of the reproductive issues that have been coming forward in a reasonably high occurrence. The first two there on the left, menorrhagia and dysmenorrhea, are extremely discomfort menstrual periods. Migraine-related menstrual cycle, related to menstrual cycle, and fibroid, and all related to that. And this might have been a regional thing. Talking to Dr. Karen, is that these things led to hysterectomies, which can obviously be devastating on multiple different levels. Also, we're seeing a very high prevalence of reports of hypothyroidism and also a range of thyroid issues, and obviously breast cancer, as well as stillbirths and premature births, which obviously have repercussions in multiple generations. And this is generally because, and this is coming from kind of this pattern that we're seeing related to health effects related to endocrine disruptors. And I just wanted to put this might be a bit scientific, but to give you a snapshot of the diversity of types of health effects that have been shown in the scientific literature related to endocrine disrupting chemicals. So they belong to a wide range of substances which interfere with hormone biosynthesis, transport, metabolism, and receptors, affecting homeostasis, development, aging, reduced fertility in both sexes, and are linked to malignant and non-malignant diseases. And there's been 10 substances documented so far with Bob and Dale's report that are known to disrupt the endocrine system. And you can find this on table 2 of their report. And this is also just to reiterate what Bob and Dale said pertaining to Paul Demir's and the OCRC study on using scientific evidence and principles to help determine the work-relatedness of cancers, and how when you have a mixture of substances that all act on the same system and mechanism and target tissue, that these should be considered at least additive, so the mixture of exposure should be considered. The endocrine disrupting chemicals and exposures have also been very well documented in the scientific literature and in the plastics industry. So these findings all warrant further investigation, not only within OCCU, but also at the WSIB and the scientific community, the larger scientific community. So I also wanted to just go into a little bit more detail, because this leads into some really interesting current work that we're doing and collaborating on at the OCRC. So Nathan DeBono and colleagues from the Dalai Lama School of Public Health and the Occupational Research Center and the Faculty of Medicine at the University of Toronto very recently published this study using the occupational disease surveillance system, and specifically looking at cancer in the plastics and rubber manufacturing industries. So the occupational disease surveillance system, it's made up of 2.18 million workers that have accepted compensation claims. So the basic information that's collected from the compensation claims themselves is actually just the industry and occupation codes that are associated to those individuals. So even if you have a hurt wrist, you would show up in this system and your occupation and industry code would then be associated to you. But then if you later developed a cancer, you would be counted as that type of cancer. It's not about what your claim was for. So what they were able to do is take the claims data and health records match that to the Ontario Cancer Registry. And what we're really interested in doing is not only looking at the cancers, which obviously are normally at the very forefront of what we investigate in terms of work-relatedness, but also the non-malignant and non-cancer type diseases like these reproductive issues that we're seeing. So that was where our relationship started with Nathan DeBono. And I'm hoping that we can possibly get him to come and speak, but I'm going to hopefully have some conversations with him about that. And the next step would be to hopefully look at the other database that they can pull data from is all the OHIP billing information. So if you were ever seen by a family doctor for any health related issue, it would be in that record. So we could potentially use this as a really powerful tool to help us understand some of the patterns that we're seeing and to substantiate those with more scientific evidence. I also want to just point out that we've also seen a very high rate of neurological conditions. And this comes from firsthand experience from Dr. Karen as well as just reports from the worker, from you guys coming forward with really high solvent exposures. And just, so the big one is something called chronic toxic encephalopathy. So it's a very complex disorder, and it's got a very difficult diagnosis. And so we're hoping to partner with some leading experts in that field and try to get some more concrete answers about the diagnoses of this condition, as well as potential contributing factors. And we can also use the occupational disease surveillance system for this as well. So I just want to say, if you are experiencing any of these conditions that I or Bob and Dale mentioned, or any other health issue, even if it hasn't been mentioned now, this is extremely useful information for our work. And if you haven't already contacted us, we'd really like to hear from you. And thank you very much.
Okay, thanks, Andrew. And and once again, if you do suffer from any of those conditions, we can, together with Local 1987, help facilitate you filing a claim with the WSIB. In addition to looking at your case more closely. We did get a question from Facebook from Mike that says, if we've been told directly from a doctor that our loved one's cancer was in no doubt caused by the workplace, why would they have any reason to deny any form of claim? Does WSIB have a better medical background than a cancer specialist? Well, I understand that it's a rhetorical question to some extent, but there have been several reviews, including the one from Dr. Paul Demers that was released a couple months ago, that was mentioned by Bob, and that have looked into the way that the WSIB handles cancer claims. And I think it's, in addition to that, there was an audit of the occupational disease program a couple of years ago, an operational audit. And I think it's undeniable at this point that the WSIB is both not equipped to and not up to date with all of the latest science. And as a lawyer, I can tell you there have always been issues with their approach to occupational disease claims. My only advice is, if you have a legal representative, or you can definitely contact OCCU and get an independent assessment from us as well, and to keep carrying on with the process. If you want to send me a personal message on Facebook, or just to call our toll-free number off our website. You can easily arrange for that. But I understand your frustration, and it's shared by many other people, certainly. And with that, I will hand it over to Scott from the WSIB.
Yeah, no, I just wanted to say thanks to Bob and Dale for the presentation tonight. We had an opportunity to meet back in August. Bob and some others, including Dave, came to the Ministry of Labor, and we had a socially distanced mass gathering. But it certainly gave Bob and Dale the opportunity to present in person. One thing I did want to respond to is really just what was being talked about a minute ago, and actually it's in Bob's slide deck, and it's a little concerning because there's one. We've adjudicated about 255 files coming out of Ventra. There's about a 75% allowance rate on everything that's been adjudicated. And there's a slide in that one deck that Bob had that showed a very large number of claims that we don't seem to have any awareness of. So where they are, I'm not sure. I know at the public meeting I was at back in August, some letters were shared with me by a few concerned parties showing claims that had maybe potentially never been submitted or have been withdrawn for one reason or another. So I just want to encourage everybody that is out there to like file a claim with us. Whether you're seeing OCAL, whether you've got a representative, whatever the case might be, if you're not sure if you have a claim, phone the WSB and find out if you have a claim. And if you don't, have one created. Because I've heard way too many stories over the years, and a few more recently, of injured workers and or their families who thought they'd had a claim or a claim that had potentially been adjudicated to the negative, and in fact, we'd never seen it. So I think it's really important that people know that. If you don't have a claim number, then it doesn't exist with us. And some of the numbers in Bob's presentation would suggest that there's potentially hundreds of claims that we never heard of. But a great presentation. I do want to thank Bob and Dale. You guys put a ton of work into that. And I know we're looking forward to having some additional conversations.
Sorry, Scott. If I could just interrupt for a second about those the Unifor numbers that Bob put up there, not self-reported by workers. Those are that's a count done by the members of the committee based on their knowledge and union records, etc. of diseases that they observed. So we're not sure how many of those people are interested in filing claims. That's why we're hoping people will come forward.
The only reason it's concerning is because I know we had a similar event up in Sudbury a few weeks ago that both you and the Steelworkers put on, and it was a very well-run event, a great event like this evening. And I know the Steelworkers have been working hard with the former employees of that plant. We've received well over 100 claims so far. Coming out of that meeting that the Steelworkers have sent to us. So I just want to reinforce them. I've always been a firm believer. I've been with the board a long time. Justice, basically if justice is delayed, it's justice denied. And I think we need to make sure that if there's claims that need to be filed with the WSB, get them in. I think it's critically important that if people, again, believe they have an illness that's come out of their work, whether it be with this particular employer or any other employer, you need to file a claim with us. And I think that's the one message I want people to take away this evening.
Just to follow up on what Scott had to say there, bear in mind that that report of the advisory committee, which was essentially a count based on their seniority lists and a fairly intensive investigation, still needs to be confirmed. And one of our recommendations is that an independent study take place to confirm those that list of diseases. I also wanted to mention that in terms of the list, which is in Table 1 on page 11, that some of the other non-cancerous diseases, are important, in addition to the reproductive abnormality. The other thing I would add to that, children, are sometimes born with various kinds of defects that are hormonally related to what the parent is being exposed to. Undescended testes, for example, or distorted sexual organs, that may have a direct bearing on what they're exposed to with respect to endocrine disrupting chemicals. The other category I would look at is cardiovascular disease. Given the extent of exposures to solvents, not only with respect to the neurological problems that seem to be identified there, but also the cardiovascular effects, also need to be looked at. Wait.
Thanks, Bob. Scott, did you have any other comments you wanted to make?
No, actually, I think Dr. Thompson was looking to respond, though I saw a question on the Facebook chat here from Mike Cook. Dr. Thompson, did you want to weigh in on that one?
So I guess I just have two comments. The Paul Demir's report, when it referred to scientific evidence, it was really speaking at the level of policy and guiding principles, not at the claim level. So I just don't want there to be any misunderstanding with respect to that. At the individual claim level, with respect to the science that's taken into account for claim adjudication, it is up to date because it's based on the most recent literature reviews of published, peer-reviewed published literature. So that's an important distinction to make. And with respect to the treating physician's opinion, that would be captured actually in the medical records, and as part of the adjudication process, when the physician consultants are reviewing the file, they would be cancer specialists, and they would reach out to the treating physician to discuss it if there was a disagreement. And so I just want to assure everyone that the opinion of the treating physician is taken into account.
Okay, so we have another question from Mike, just about the chances of overturning WSIB claim on this kind of an issue. Again, I can tell you as an experienced legal representative that many cases are overturned on reconsideration or appeal. And again, I'd encourage you to contact us at OCCU if you're interested in another assessment of the medical or hygiene issues. You could call us at the number we gave earlier, in fact, and then I'm not sure if you're part of the Ventra situation or somebody who's located us through the Facebook feed, but that number is 1-800-461-7120. If you call there, we'll make sure you get routed to the appropriate clinic or office, and we can talk with you some more about the individual case offline. Okay, so with that, I will hand it over to Bill Roy for a final word.
Good evening, everyone. Thank you so much to OCCU, to Unifor, and for inviting MLTSD as well as WSIB to tonight. So I work in the prevention office under the Chief Prevention Officer, Ron Kleski, and I'm the director of the Strategy and Integration Branch. So our branch is responsible for setting a strategy for the province. We also work with our transfer partners like OCCU on making sure that they get funding for this important work. So I wanted to start tonight just by talking about something that we're all facing right now, COVID-19. And before we started, I had an opportunity to talk to Bob and Dale, trying to understand how are we dealing with the pandemic? Is it really a pandemic? Are we hurting ourselves by staying indoors? And so there's so much science around that, and we keep hearing that the government is working on science. I certainly want to make the commitment that everything that we're doing as far as our new strategy moving forward, any of the work that we're doing in occupational disease and just generally targeting unsafe workplaces is all going to be based on science. That's something that we've doubled down on. One interesting thing, and I guess I sound like a broken record, I say it every time I'm in a meeting, what COVID has done, however, is made health and safety front and center in the workplace. And so I hear my neighbors talking about, do they need a mask or do they need PPE, like a full N95, and what are the controls that are in place? And I honestly have been doing this for 19 years now, and I never would have thought that I would be in this situation where health and safety is taking a priority in the workplace. So this is really a good opportunity to take advantage of that heightened awareness, to kind of shine a light. Sorry, my cat's talking to me. Trying to shine a light, on the burden that occupational disease has amongst workers. Every year there, generally, or I'd say around 60 people lose their lives in Ontario, unfortunately, in traumatic injuries. However, that number, triple that number, is how many people lose their lives as a result of occupational disease. So it's a significant impact. It's a significant burden on the system. And the way that we look at it is that there are two ways to approach it. The first is preventative, so that's understanding events like tonight and looking at surveillance and looking at data and trying to understand how we get that information out to workers and make sure that they do see the MSD sheets so they understand what they need to do for their own personal protection and make sure that training's in place. The second half is more claims related, right? It's these longer latency illnesses, these longer latency diseases, and that is in the realm. That's what OCCU is there for, right? Is to offer you a place to go to get that medical assessment, and the WSIB in order to put through that claim and have that arbitrated. So you heard talk about different reports, and certainly those are things that we're taking into account. There's the Paul Demers report, which is something that the ministry, the government, actually had that contract with Paul. And as Dr. Thompson said, it was to look at the approach that we take from a policy point of view. When we're making decisions on our laws and when we're making decisions on policies at the WSIB, are we taking into account the science of exposure to a possible causation to a disease? And so, we want to continue to do more and more of that. So as you heard from Bob earlier, the report committee recommended that we need to do surveillance work for workers in the plastics industry. So events like tonight help us to gather that information. The information that the DiMatteos collected as well as OCCU, it's important steps in gathering that surveillance data. So understanding occupational exposures, the related processes, and ultimately any relatable illness or disease is an integral part of making a workplace safe. So you also heard from Andrew. He was talking about that science and the research, and I'm glad he did my job for me. I was going to tell you that as far as that recommendation about surveillance, I'm going to link that now. The Ministry of Labor, sorry, I keep saying Ministry of Labor, but that's not us. We're the Ministry of Labor Training and Skills Development, which is a new name that. Sorry, I can't multitask. Copy, paste into the chat. Can I do that? There we go. So the Ministry of Labor Training and Skills Development, what happened is the training portion of the Ministry of Training, College and Universities came over to the ministry. And so our ministry now is like the Ministry of Work, where at the front end, if you're going into a skilled trade or you're in school, or whether it's primary school or into high school or even into colleges and vocational work and universities, we're trying to embed health and safety in all of that work. Then comes the prevention, training and awareness up front before you enter the workplace, training that's mandatory when you get there. And then the oversight from enforcement. And, we come in and we try and help employers with compliance support to make sure that they're doing the right thing. Then it moves into, sometimes a workplace closes and you lose your job, or you're laid off, and we have Employment Ontario, which is a new part of our ministry now, providing skills training and health and safety training for free to get people back on their feet and potentially into a new job. And then ultimately, the Office of the Worker Advisor, Office of the Employer Advisor, and WSIB, who are those outside agencies, including the Workplace Safety Insurance Appeals Tribunal, WSIAT, that are all outside agencies that are there to support workers and employers. So, I put a link into the chat. So this is the site that Andrew was talking about. So Ministry of Labor, Training, Skills Development, in partnership with the Ministry of Health, are jointly funding this occupational disease surveillance program. He had SS surveillance system, but ODSP is actually where you're going to find it on the internet. And that site actually talks about all the different areas that we're currently watching. As you heard, it's almost 3 million workers that gathering their information and looking at that information as it relates to the cancer registry, the CAREX system, and there are all kinds of data sets. So really, it's trying to apply the science to figure out what were the exposures and do those exposures continue in workplace now. Plastics industry still exists, right? You're still working. So are we learning anything to be able to apply controls to stop you from getting exposed now? And that's a huge thing that we're trying to do. And so, yes, we're ultimately funding that. I think the other recommendation related to research, we've just introduced a new research framework for our government. And so we're going to be partnering with WSIB, with all of our research associations to do exactly that, to find targeted areas where we need to research now to get information for the future. So if it's endocrine inhibitors, if that's something that we're missing information on, then absolutely let's start to do further work. And a nod to the Dialana School and OCRC for doing some of that work already. So workplaces are important settings to target the prevention of cancer and other diseases. So for one, workplace exposures tend to be higher than in the general environment. And on average, Canadians spend about 1/3 of their waking time at work. You're almost at work more than you are at home. So it's a priority for the Ministry of Labor, Training, Skills Development to treat occupational disease with the same seriousness as traumatic injury or physical injury. And that's something that started with the last government under Minister Flynn, and that continues to today with our minister now, Monty McNaughton. There's a commitment. He doesn't want to, if you're injured, you're injured, full stop. And so that's something that we really want to focus on. We can't accomplish this without our partners. So one thing that, you heard from Scott, based on my experiences, and this is me personally, not talking as government, although I'm here as government, I've seen now multiple clusters come up, like the ones we're talking about tonight at former Pebra Ventra. And I can't stress enough how important it is to get a claim. You can file a claim yourself. You don't need to be represented if you're bad with the computer. Just make that phone call. The work that OCAL is doing is significant. It's very important, and absolutely, you need to reach out to Janice and talk to her. It's fantastic that you can you reach out and you're able to contact with her and gather information for the group. As Andrew said, all of the information is vital for us in order to take a look at these exposures and the diseases that are currently that people are currently experiencing. So since 2017, what we've done at the ministry and with our system partners is we've put together what we call the OCC Action Plan, so Occupational Disease Action Plan. So what we've been able to do so far, we've had regular annual communications. So we'll put out information on noise-induced hearing loss or vibration, or it could be something specific like exposures in nail salons. Not only are they migrant or temporary workers or vulnerable workers, but they're also getting exposed to all these chemicals they don't even have an idea about. And so that was something that we worked with the City of Toronto, the Occupational Disease Research Center out of St. Mike's Hospital, the OCRC, putting everybody together. OCAL was part of it, and really targeting workplaces that where workers are vulnerable. So every year we focus on another big topic. We're doing a campaign and toolkit to raise awareness on the prevention and control of respiratory hazards. So that's like any work with asbestos or silica or isocyanates. resources on diesel engine particulate or exhaust. We've again, looking at the numbers, a lot of people in the municipalities or in the municipal sector, all the bus drivers, whether they're mechanics in the warehouse or whether they're a driver of the bus, these individuals are getting exposed day after day to diesel particulate, and it's carcinogenic. And so, working to figure out how do we solve these problems. Also, I've got to give the credit to OCCU. So they worked with CCOHS, which is I think the Canadian Council of Occupational Safety and Health, or Health and Safety, and they've put up a website. So that website is called preventdisease.ca. I'm going to paste that one as well. And it's a fabulous place to go. It's got resources and tools and information sheets that you can bring into your workplace and you can use to try and gauge your exposures and what are some of the illnesses, things that we talked about tonight, but right across the spectrum, covering all sectors. So, we continue to build on that action plan. It was something that the health and safety system was audited internally to make sure that we were getting a return on our investment and that we were being efficient with the dollars that we were spending. And one of the things that was highlighted in that audit was the occupational disease action plan, and the auditor said, "Keep going with it because you're showing results." So for me, that's very exciting. One of the things I talked about at the beginning is that my branch also develops the strategy for the province. So this is the strategy to reduce injury, illnesses, whether it's like mental health or workplace violence in the workplace, and to reduce those rates as a system here in Ontario. So we're currently working on the next strategy, which will be released by March 31st. So it will cover 2016 through to 2021 through to 2026. And so that's a 5-year strategy. What we want it to be is like a blueprint, so whenever someone is going to start some work, whether it's OCCU or WSIB or one of our health and safety associations, everyone's doing it in a systematic way so that all of our work links up. We don't want the scattered approach. It's like going to Google and searching for, occupational help in Ontario. You're going to get 1.38 million results in half a second, but what does that do for you? It's like turning on your high beams in a snowstorm. It just doesn't, there isn't like a specific spot you can go to get this help. So we're trying to make the system better. So if you talk to OCCU, they're going to refer you to somebody. If they can't help, they know who to send you to, or vice versa. So again, trying to make this more of a system. One of the big pillars, I hate using pillar because it's a government word, one of the big focuses that our system is going to really drive to solve is occupational disease. We've already, as you heard tonight, there was the value for money audit that was part of the occupational disease program at WSIB. We've had Dr. Demers and his reports. We've had some research that we funded to take a look at, what we need to fix. We've developed the surveillance program. We've been working with the Ministry of Health to try and understand how they deal with it. And, I think really we need to switch to like an epidemiological model where, as you heard from Bob and Dale, right, that we need to apply science to it. It can't just be stories, and a collection of these qualitative lists of information of what the programs were and what the processes were. We need to be in workplaces and understanding what people are getting exposed to now, so that in 10 years, 20 years from now, we're not having nights like tonight, that we're ahead of the curve, that we're doing that prevention. So, I want to assure you again that, we're doubling down on occupational disease. That's a focus. How fantastic would it be to be able to know from work that we're doing in meetings like tonight is going to save hundreds, if not thousands, of lives in the future if we can understand the science of it and prevent it, and so in the future there aren't workplaces that are unsafe for workers. So again, thank you very much for having me. As always, I'm sure that you can get my information from Dave or anyone there at OCal. If you have any questions tonight, absolutely feel free to ask them. But at any time, reach out. We have a 1-800 number that you can call for health and safety related issues. If you want to report unsafe work, please do so. Even if you're talking about a son or a daughter or a niece or a nephew that's working in a workplace now and you want to report on their behalf, please do that, because we'll go into that workplace and we'll make sure that it's safe. So I think that it's 1-888-202-0007. I'm gonna have to figure out that number. I should know that off by heart. I'm horrible, but I'll get the number and make sure that I post it in the chat. So absolutely, thank you for having me. So I'll give it back to you, Dave.
Okay, thanks, Bill. Okay, we've got also the 800 number for the WSIB has come up in the chat, 1-800-387-0750. We'll leave it open for a couple of minutes if anybody wants to come back with any questions or comments in the chat or on the Facebook chat. I would again just encourage everybody who's concerned about health issues to A, file a WSIB claim, and B, also contact Local 1987 and OCal, register with us, and we're very interested in gathering your information. Even if the WSIB allows your claim like that and you don't need our help, we can certainly use yours and would very much appreciate it. And again, we will be organizing some future information events once we've completed our intake process with folks and all the questionnaires that Janet mentioned, and to share back what we've been finding, and to touch base with researchers in the area, and get those who are interested to come and make some presentations for you as well. I know that most researchers in this area are very interested in having direct contact with the people who are affected in the workplace by the issues that they're studying. And I'm anticipating that we will have some positive responses, and be coming back to you in the coming months with some of those presentations. This tonight's webinar will also be slightly edited to take out some of the silent areas and what have you, and posted to YouTube within the next couple of days. I think the last one went up the next day even. We'll be sure to publicize that link as well on Facebook, and to get some emails out to folks that we do have contact with already and have the email addresses for. And please pass along the information to friends in the workplace and anybody else you think might be affected. I know that Ventra is still have continued to work through the pandemic and are working 3 shifts, so it's hard to get everybody together to watch an event like this, or to effectively publicize it even. But we're gonna, like I said, we're gonna make it a permanent document. So please direct people there, and we'll do our best to get some other events going in the relatively near future. Okay, so with that, seeing no more questions coming up in the chat, we'll shut her down. Thanks everybody for attending. Thanks to all the presenters. I thought it was very interesting and useful webinar. Thanks. Bye-bye.